Hello, my name is Emily Greenfield, and the purpose of this video lecture is to introduce the concept of effectiveness in the context of aging services. Let's begin with our case example. Mrs. M is an 85-year-old woman who lives in a rented studio apartment in Trenton, New Jersey. Most of her income is from Social Security, about $1,500 per month. Mrs. M recently slipped on a rug in the entranceway to her unit. This resulted in a sprained right ankle. She is now unable to get in and out of her shower safely, and she also has difficulty managing the steps up to her building. She also has lost her ability to drive, given that her ankle is not strong enough to press on the accelerator or brake. Mrs. M's daughter lives in Newark, New Jersey, and does her best to visit every weekend to help with grocery shopping, housekeeping, and cooking. However, her daughter works full-time and has young children, and therefore cannot make the drive as often as she or Mrs. M would like. We can imagine that in this scenario, Mrs. M might be receiving services. For example, she might have been able to arrange to have visits twice a week from a home health aide, or she might be able to utilize a county-based transportation system to help her get to her medical appointments. Effectiveness basically means, are these services achieving what they are intended to achieving? For example, do the visits from the home health aide lower Mrs. M's actual risk of falling? Or does the county-based transportation system actually prevent Mrs. M from missing important medical appointments? Here we have our definition of effectiveness: the extent to which resources, services, and supports are achieving whatever they are set out to accomplish. In the context of Mrs. M, we've already discussed effectiveness at the level of a single individual receiving services. However, it's important to note that we can also think of effectiveness at the level of a group of many people using services from a particular organization. For example, all the people who might be receiving services from the home health agency that Mrs. M is using, or all people using the services from the county transportation provider. We can also think of effectiveness at the level of broader populations, such as the effectiveness of transportation services across all providers in New Jersey. Here are three considerations that I will discuss in the following slides around assessing the effectiveness of aging services: identifying outcomes, measuring those outcomes, and thinking and examining subgroup differences in outcomes. First, let's talk about identifying outcomes. Upon first glance, thinking about what aging services are supposed to do might seem pretty obvious. The services are supposed to help people, right? However, to make the case for the effectiveness of services, it is increasingly important to be able to specify in what ways are the services supposed to help. Let's take the example of home-delivered meals or Meals on Wheels, which is considered a bread and butter type of aging service. Take a moment to think about what outcomes we can expect from the delivery of meals to homebound elders, as depicted in this picture. On the face of it, meals, of course, are intended to promote nutrition among vulnerable older adults who otherwise are unable to access nutritious meals because they can't get to the store or they can't easily cook for themselves. However, what other outcomes from this service might we expect besides nutritional safety? Perhaps we would expect reduced food insecurity, that is, older adults lower perceptions that they're going to be unable to meet their own nutritional needs. How about reduced social isolation? Given that a person is going to the older adult's door to deliver the meals, if they're truly isolated, this might be an important mechanism of socialization and reduce their social isolation. Perhaps these immediate outcomes, that is, reduced social isolation and better nutrition, might lead to better mental and physical health, which ultimately might lead to an older adult's lower risk of institutionalization or needing to be moved into a high level of care, such as in a skilled nursing facility. Specifying these outcomes as well as how they are related to each other is key in thinking through the extent to which a service is effective. Now that we've identified outcomes, we can think about how we might measure them. Sometimes people are quick to say, these things can't be measured. How would you possibly go about assessing, for example, whether someone is socially isolated? Well, thankfully, in social science, there tend to be actually pretty well-developed measures to assess important outcomes that we might expect from aging services. So on this slide, here's 3 examples. Food insecurity first. How might we measure that? Well, we could ask a person, in the past 30 days, have you been concerned about having enough food to eat? This could either be a yes or no question, or we could ask people to rank how concerned they've been on a scale 1 through 5. As another example, we can measure reduced social isolation through questions such as, how often are you in contact with other people? And giving them structured response items like several times a day, about once a day, several times a week, etc. And we can even measure people's their mental and physical health by asking them questions, right? Such as, in general, would you say your physical health is poor, fair, good, very good, or excellent? And we call this question an indicator of self-rated health. Now, it's important to remember that if we just ask a group of people receiving Meals on Wheels, let's say, how they would rate their health, we're not sure if they would say that their health would be any different if they weren't receiving those meals. So incorporating those insights from your research classes, we could say that it's especially important here to perhaps ask people about their health before they receive their first meal, let's say when they're enrolled for Meals on Wheels but haven't yet received their first one, as well as after they've received several meals, so that we can see if there's a change over time. Another way to measure this outcome in terms of seeing if the Meals on Wheels has an impact would be to have a control group. So we could have a group of people who are receiving Meals on Wheels and ask these questions, and then we might ask these questions of people on a wait list for Meals on Wheels, and hoping that the people who are receiving the meals are scoring better in these areas than the people who aren't, in order to demonstrate effectiveness. Finally, when considering effectiveness of aging services, it is important to think through potential subgroup differences in program effects. This leads us to reformulating a question such as, are home-delivered meals effective for reducing loneliness, to, for whom do home-delivered meals reduce loneliness? We might suspect, for example, that Meals on Wheels reduces loneliness only among those who are very isolated to begin with, people who are very far removed from any family caregivers, who live alone, and for those that prefer a more solitary lifestyle in their own homes that keeps them from participating in other social engagements. As discussed in the text by Niles, Yoakum, and Wagner, the traditional aging network, as defined by the Older Americans Act, does not have a long history of evaluating the effectiveness of the services funded through this act. Many areas on aging, for example, evaluate their program in terms of the number of participants that utilize particular services, such as the number of home-delivered meals provided or the number of people who visited a senior center over the course of the year. In an era where policymakers and other grant makers, such as private philanthropies, are increasingly asking for evidence that the investment of resources into a particular program yields actual results for older people and caregivers, aging services providers are challenged to step up their evaluation efforts, especially in terms of documenting the intended outcomes of the services that they deliver. To further demonstrate this point, let's take a moment to consider this article by Thomas and Moore, which was published in the fall of 2014 in a major health services journal, Health Affairs. This article presents a study conducted by researchers at Brown University, which addresses the effectiveness of home-delivered meals, specifically in terms of keeping older adults with low care needs out of institutional settings, meaning skilled nursing facilities. Using state-level administrative data from a variety of government sources, the researchers found that if we, as a nation, increased the number of people ages 65 and older receiving home-delivered meals by just 1%, states could collectively save over $109 million. Let's take a moment to identify two aspects of the study that make it stand out. First of all, this is one of the few examples of more rigorous evaluation research on foundational services provided through the Older Americans Act. Even though Meals on Wheels has received federal funding for decades now, this only very recently have researchers actually examined evidence for whether it makes a difference for helping older adults live and remain safe and comfortably in their own homes rather than in higher care settings. Also, this study looks not only at outcomes of the service, but also at cost savings. Cost-effectiveness research is especially valuable to policymakers in today's climate of less government spending. In short, advocates increasingly need this type of research to make stronger arguments regarding the importance of increasing or even maintaining public spending on services such as home-delivered meals that are provided through the Older Americans Act. This concludes this video lecture on issues concerning the effectiveness of aging services.